Today we are going to study about the gross anatomy of the kidney, and we will discuss it under the following headings, that is definition and the function of the kidneys, shape, size and weight of the kidney, location of the kidney, its gross features like borders, surfaces, poles and hilum, then structures at the hilum and role of hilum in site determination, then relations of the anterior and the posterior surfaces, and naked eye examination of the coronal section of the kidney. Kidneys are a pair of excretory organs situated one on each side of the vertebral column, and they are behind the peritoneum, that is retroperitoneal in position. Kidneys are also known as rennes, from which we have derived the term renal, and nephros, from which nephron has been derived. The function of the kidneys is to remove the waste products of the metabolism, excess of water, salt from the blood, and maintains the pH of the blood. Now coming on to the shape, size and the weight of the kidney. The shape of the kidney, each kidney is bean shaped. Weight is about 130 to 170 grams. Now various measurements. The kidney is about 11 to 12 centimeters in length, 6 centimeters in width and 3 centimeters in thickness. The vertical extent of the kidney, that is the vertebral level, is from T12 to L3, that is lumbar third vertebra. The transpyloric plane passes through the hilum. The longitudinal axis of the kidney, it passes obliquely downwards, like this, and in such position the upper pole of the kidney, it lies approximately 2.5 centimeter from the median plane, whereas the lower pole is still farther, it is about 7.5 centimeters from the median plane. The hilum of each kidney, it lies about 5 centimeter from the median plane and lies at the level of transpyloric plane. And this transpyloric plane, it passes through the lower part of the hilum of the left kidney, the lower part, and the upper part of the hilum of the right kidney, because our right kidney is at a lower level than the left one, and it passes approximately like this. That is, from the lower part of the left kidney, hilum of the left kidney, and upper part of the hilum of the right kidney. The transverse axis of the kidney passes backwards and laterally, and our hilum faces forwards and medially like this. The gross features of the kidney. Each kidney has got 2 poles, 2 borders and 2 surfaces. The 2 poles are upper pole, this is the upper pole, and the lower pole. Borders are lateral border and medial border. Surfaces are the anterior surface, this is the anterior surface, and the posterior surface. Poles are upper and the lower. The upper pole is broader and is in relation with the corresponding suprarenal gland. Like here in the right kidney, we have the right suprarenal gland attached to the upper pole. The lower pole is pointed, and both the lower poles, they are about 2.5 centimeter above the iliac crest. Now the borders. We have the lateral border, which is smoothly convex. This is the medial border of the kidney. It is concave, and in the center of it shows a depressed area, which is known as hilum. The hilum plays an important role in site determination, and it has got some structures from anterior to posterior direction. They are renal vein, renal artery and renal pelvis. Most posterior structure you can see is the renal pelvis, and from the lower pole of the kidney it becomes the ureter. It continues as ureter. Now this is renal vein. It is identified by having a thin-walled structure and a collapsible lumen. We can see here thin-walled structure which is having collapsible lumen. Then In the center we have the renal artery, which is thick walled and has a patent lumen. Most posterior structure is the renal pelvis. Coming on to the surfaces, the anterior surface is irregular, whereas the posterior surface, it is smooth. We can see the posterior surface is smooth. In this kidney, this is the anterior surface, which is irregular, and this is the posterior surface, which is smooth. We can also determine the anterior and the posterior surfaces by seeing the structures at the hilum. Coming on to the site determination. For site determination, we focus on the structures at the hilum. From anterior to posterior, they are the renal vein. How we determine the renal vein? It is having thin wall and collapsible lumen. We can see the collapsible lumen. Then we have the renal artery, which is having the patent lumen, and it is thick walled. Most posterior structure is the renal pelvis, and it is directed towards the lower pole of the kidney. So we can determine the pole, lower pole also from here. Now we know the most anterior structure is the renal vein, so this is the renal anterior surface, and most posterior structure is the renal pelvis, so this is the posterior surface. Now we know about the upper pole and the lower pole. We know about the anterior surface and the posterior surface. We can say this is the kidney of the left side. Likewise, if we hold this kidney, the most anterior structure at the hilum is the renal vein, then is the renal artery, and most posterior structure is the renal pelvis, and it is directed downwards towards the lower pole of the kidney. We know from here that this is the lower pole, and since this is directed posteriorly, this is the posterior surface, and the renal vein is anteriorly, so this is the anterior surface, and upper pole is broader and it is having the right suprarenal gland attached to it. This is the kidney of the right side. This is the diagrammatic representation of anterior relations of both the kidneys, that is right and the left. Now we will see in the specimen. The anterior relations of both the kidneys, that is right and the left, they are different on anterior surface, whereas they are same on the posterior surface. This is so because we have different viscera on the right and the left side. Now coming on to the anterior relations of the right kidney. The anterior surface of the right kidney along the upper pole and part of the medial border, upper part of the medial border is in relation with the right suprarenal gland. See here we are having the right suprarenal gland attached to the upper pole and part of the medial border. Below that, this right half of the anterior surface is in relation with the right lobe of the liver, close to the medial border, that is close to the hilum. It is in relation with the second part of the duodenum, and lower down it is related with the right flexure of the colon and the coils of the jejunum. Moving on to the relations of the anterior surface of the left kidney. The upper part of the medial border is in relation to the left suprarenal gland. Spleen is related to the upper 2/3 of the lateral half of the anterior surface. Medial to it is the gastric area, that is, it is in relation with the stomach. Below the stomach and the spleen, it is in relation with the body of the pancreas and not the tail, because tail is in relation with the hilum of the spleen. Below the pancreatic impression, we have the relation of the splenic flexure of the colon and coils of the jejunum. This is the diagrammatic representation of the relations of the posterior surface. Now we will see these relations on the specimen. Coming on to the relations of the posterior surface. The relations of the posterior surface of both the kidneys are same, and they are in relation with the diaphragm and 3 muscles from medial to lateral side and 3 nerves from above downwards. Except the right kidney is in relation with the 12th rib because of its lower position, and the left kidney is in relation with both 11th and the 12th ribs because it is at a higher level. Upper part, it is in relation with the diaphragm and medial and the lateral arcuate ligaments. The muscles are from medial to lateral side are psoas major, quadratus lumborum and transversus abdominis. The nerves are from above downwards. They are subcostal nerves and vessels, iliohypogastric nerve and ilioinguinal nerve. Now coming on to the naked eye examination of the coronal section of the kidney. We will concentrate on this part of the coronal section only. The coronal section of the kidney shows outer cortex. Inner to the cortex is the medulla. Then we have the renal sinus. This part is the renal sinus. The inner medulla, it shows conical masses known as renal pyramid. You can see here conical masses which are known as renal pyramids. The apices of these renal pyramids, it opens into the indent the minor calyces. This is one of the minor callus into which the apex is indenting, and these apices are known as renal papilla. This is known as renal papilla. Now, the part of the renal cortex that arches the renal pyramid is known as cortical arch, and the part of the cortex that dips between two pyramids, this is the part of the renal cortex which is dipping between two pyramids, is known as renal column. Now, cortical arch and the renal pyramid together they form the lobe of the kidney. Coming on to the renal sinus, the renal pelvis enters into a space known as renal sinus. All other structures of the hilum like renal artery, renal vein, they also enter from the hilum into the renal sinus. The renal pelvis, it divides after entering into the renal sinus into major 2 or 3 major calyces. We can see one of the major callus here. This is the major callus. The major calyx further subdivides into minor calyces. Into the minor callus, this minor calyx, it forms a cup-shaped depression into which the apex of the renal pyramid opens. So, this is the coronal section of the kidney and various parts. That is, to recapitulate, it is outer cortex, inner medulla and innermost the renal sinus, comprising of major and minor calyces, tributaries of the renal vein and branches of the renal artery. That's all. Thank you.